Hi, I'm Chris Badger, I'm the Interim Director of Adult Care Services for Hertfordshire County Council. So last week I took over from Ian McBreath, who I'm sure many of you will have known, who has left the County Council to take up a similar role in Bradford. So I wanted to just share a few thoughts today, really, as part of my second week in role, to talk about some of my plans, but also to introduce myself. So previously, I was operations director for older people for the county council. So I work very closely with a number of you around services for older people, and have also over the last few years worked in roles in the NHS. As well as working very closely with colleagues in HCPA on things like the Care Home Vanguard, working closely on the uplifts that we were able to award last year, home care contracts, as well as our continued work on monitoring, training, and development, as well as Good Care Week. So firstly, I wanted to say a massive thank you for all that you and your teams have done during the COVID-19 crisis. I know a lot of the attention nationally goes on to the NHS, which is important, but I'm not sure the care workforce and care organisations get quite the recognition they deserve for all the work that they've done. And certainly in Hertfordshire, we've seen colleagues work really innovatively, working really hard and continuing to maintain really good services for the residents of Hertfordshire. So massive thanks from me for that. I know we've still got loads of work to do, a potentially really difficult winter, but I wanted to thank you for all your efforts so far. So, as director, one of my priorities, and this is very much in line with where Ian has been thinking, was to absolutely continue the support to providers across Hertfordshire, both for the next 6 months over winter and over the medium term, whether it would be financial support for COVID around advice, guidance, PPE, training and development, and recruitment. I'm wholly committed to that being the number one priority for the county council. If we support providers in the right way, most other things will look after themselves. So you can take it from me that that will continue to be a priority. We'll be communicating with you in late August about what the nature of our support package to providers is likely to be after the end of September, when the current arrangements stop or run out. I'm confident that'll be a support package of a really good standard, really based on continuity of what we've been able to do already. Clearly, there's some uncertainty about how much money is available from government, but we'll do all we can to continue the support that we've been able to give you to date and communicate that really clearly in August. I'm really keen that as we move to a different stage in the pandemic, we really think about how we can really get a renewed focus on quality and work together with yourselves, CQC, and other partners to make sure we engage on the quality agenda again, working really collaboratively on how we can learn lessons from the pandemic around quality, but also understand how we can do monitoring, contract management in a way that minimises the burden for you, but focuses on those areas where I think collectively we need to improve, and identify the support that you might want to help you along that journey of improvement. I wanted to say a little bit about some of the lobbying we're doing with government. We share a number of frustrations around some of the continued issues with testing, the continued issues around some of the availability of PPE, and the uncertainty around finance and long heralded social care reform. We share a lot of those frustrations, and we're working really closely to lobby government to try and sort those issues out, whether it be through various local government associations, or indeed through the Association of Directors of Adult Social Care, who are now working very closely with a number of care provider associations to make those points to government. Conscious that we've got a potential of a second spike and winter coming through, it's really important that we learn the lessons from the first wave of COVID, and particularly around testing, around the supply of PPE. But also, I think we'll be moving to a position where we'll be looking at local intelligence around lockdowns and local intelligence around outbreaks. You can get a lot of that data yourself actually on coronavirusdata.gov.uk, and that's got a really good interactive map to show you where spikes of infection may be happening at a very, very local level. That will inform things like visitor guidance, which I know the Director of Public Health, Jim McManus, has recently written to you about, as well as some of the issues you may face around staffing in terms of where staff may be subject to lockdowns or where there may be a higher risk of transmission in the community. So just one example of the resources that we'll give you. I'll be in touch probably later in August to talk about the support that we'll be able to provide after the end of September, and I'll probably do that with a video as well. But more than welcome to take feedback on what that looks like. In the meantime, please do continue to use the HCPA portal that we've set up jointly with the HCPA, which I think is an excellent resource. And I'd really like to thank colleagues in HCPA for how they've worked with us collaboratively during this crisis, and that's a relationship that I'm really committed to continuing with the sole aim of supporting you in all the great work you do every day to care for Hertfordshire citizens and their families. So thanks again. I hope you get some kind of break over the summer, and I'll be in touch soon. Thanks a lot. Bye.